Once the pandemic began, in the first lockdown, the proportion of adults in England who reported drinking at levels that we would consider to be risky was about a third, just under a third. Even within that group, there's a huge range from people who are just over the line to people who are drinking, at extremely high levels. But it's a not insubstantial proportion of adults.
I do know there was a 20% increase in alcohol-specific deaths in England and Wales in 2020, and that pattern has persisted into 2021 and into 2022 as well. That takes alcohol-specific deaths to the worst levels on record. These records have been collected for about 20 years. So this figure of alcohol-specific deaths, it might sound kind of, well, what exactly is that? What's happened to those people? These are figures from the Office for National Statistics that are published routinely. And the definition of an alcohol-specific death is quite a precise one that they use. But 80% of those deaths are due to alcohol-related liver disease. So mainly they are liver-related deaths.
So we have information about people's occupation, so we can categorize their their socioeconomic position based on their type of employment. And so we know that people who were employed in kind of manual jobs saw bigger increases, or will see a bigger increase in their harm than people who are employed in kind of professional managerial roles. So even though people in the managerial jobs were more likely to have increased their drinking by slightly more on average, because the harm that's experienced by lower socioeconomic groups is so much greater to start with, the increase in harm is much bigger in that group. So we already have very, very stark inequalities in alcohol-related harm in this country, and the pandemic has only widened them.
We've modelled 3 different scenarios for what might happen with future drinking patterns, and we're looking all the way up to 2035. So for 9 diseases related to alcohol that we've looked at, high blood pressure, stroke, liver cirrhosis, and 6 types of cancer, there's 200 diseases related to alcohol. So we're only looking at a snapshot. We have projected that there'll be additional costs to the NHS between £360 million and £1.2 billion by 2035 as a result of the changes in drinking that have happened during COVID.
The total amount of alcohol being drunk and sold, obviously, is pretty much unchanged since prior to the pandemic. It's not just a stereotype, it's actually true that we drink more beer in pubs and we drink more wine at home. And so the beer industry will have lost out because we're drinking less beer, and the wine industry has been a winner in that we've been drinking more wine. And it will be interesting to see how those trends continue over time. But from the perspective of public health, it doesn't really matter whether we're drinking beer or wine or spirits. What matters is how much we're drinking overall and who's doing that drinking, right? It's the heavier drinkers that are the ones who are really suffering the harm. And so the fact that those are the people who have increased their drinking, that's really concerning.
In terms of the inequalities in alcohol harm getting wider, there's already a lot of research that explores exactly why that is. There's reasons around access to healthcare is one example. In terms of how our research and how the inequalities might widen in the future as a result of COVID, but then also now as a result of the cost of living crisis as well, we really would need more research to understand exactly why there's been an increase in alcohol specific deaths that's been concentrated in more disadvantaged groups. We would need to ask people questions about how their lives have changed.